Well, today is Constitution Day. I've got a flag tie on here instead of the usual university and college tie that I wear. You may see also the two helmets. Tonight's going to be a fun game, and Bengals will be playing at the Browns and national TV Thursday night football. So we're excited about that. I want to introduce my wife, Fran, who really has, I think, some exciting news about a new partnership. Fran?
Earlier this week, the Ohio Governor's Imagination Library and COSI announced a partnership that'll help kids in need connect reading with hands-on science. COSI is traveling the state to provide learning lunchboxes to children. These learning lunch boxes include lunch, a STEM kit with fun experiments, and an enrollment form for the Ohio Governor's Imagination Library. I want to show you one of these great kits. This is actually one that they did with that they partnered with the Department of Agriculture to make this, and it's about water quality, and there's a lot of experiments in here to do, and it's just lots of fun things. So they've partnered with the Columbus Library, and they do lunch. The lunch is actually furnished by the Hunger Alliance, and the kids can check out books as well. Yesterday, COSI was actually in Athens, Ohio, and it was the local food bank that was sponsoring a food giveaway. And so the kids also got the little STEM boxes. So I think they're finding lots of fun ways to do this and getting food to the kids as well. And next week they'll actually be in Canton, so they'll be giving away some boxes there too. But it's important for children to continue learning during these challenging times, and partnerships like these help to bring creative solutions to Ohio families. So we're really excited. COSI also recently launched a digital story time on their COSI Connects platform. And to celebrate the launch of the partnership, I got to read one of the Ohio Imagination Library books, As an Oak Tree Grows. So this is kind of a cool book that some of the kids are getting this year. And after I read the book, Dr. Bertley from COSI did a fun experiment to learn about how trees grow. So COSI, if you want to find out more about this, visit the COSI, www.cosi.org connects to see this video and a lot of the fun experiments that you can do right at home. Thanks.
Thanks, Fran. Well, today is Constitution Day on September 17th, 1787. Our country's founders signed the new United States Constitution. It really was a miracle. There's a book that I read a number of years ago. I think it's called Miracle at Philadelphia. And what they gave us has endured and thrived throughout the years. It's really provided a roadmap for Americans and freedom-loving people really all over the world. The words of the preamble, we the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America. And that is the preamble. And I wanted to give a shout out to all the social studies teachers out there in high school and grade school and junior high. Thank you for what you're doing. When Fran and I got married, I thought I was going to be a social studies teacher. It didn't work out, but my admiration for all of you and what you do every day is very great because teaching the next generation about our Constitution, next generation about our country, is so very, very, very important. When I was a member of the United States Senate in 2003, and this is real participatory democracy. A group of students from Lynchburg Clay High School in Highland County wrote to ask why we didn't have a holiday to mark Constitution Day. So I drafted a resolution. Ultimately, Senator Byrd from West Virginia was able to get this passed and to mark September 7th officially as Constitution Day, and provided that all schools should teach about our Constitution. Some good news from the Ohio Department of Natural Resources. Director Mary Mertz this morning, the Ohio Department of Natural Resources Division of Wildlife shared the preliminary results from surveys in the western basin of Lake Erie measuring walleye and yellow perch hatches. Survey found that both walleye and yellow perch hatches are above average, continuing an exceptional era of fish production in Lake Erie. This year's survey sample was outstanding for this part of Lake Erie and is following the trend of a projected historic high for walleye population in the western basin in 2021. Good news for those who love to fish. And kind of on a personal note, I think Fran and I finished up maybe the last of our Lake Erie walleye and perch not too long ago. Eric, let's go to the data. Take a look, data slides. We continue, as you can see, to kind of hover around 1,000. It goes down on the weekends, but it continues to go back up. We just can't seem to get the number of new cases down significantly, fairly flat in regard to that. Tragically, 25 deaths have been reported to us in the last 24 hours. 65 hospitalizations, which is very similar to the 21-day average. ICU admissions is up over that average. Okay, Eric, let's take a look at the next one. This is last week's alert. This is this week's. And we'll talk a little bit about this. 69 counties stayed the same. I mean, really what you're seeing is just kind of the spread of the virus over the state. 69 counties stayed at the same level. 2 counties, Preamble and Summit, dropped from red to orange. So congratulations to Preamble and Summit. We are seeing a shift throughout the state, though. 11 counties moved from yellow to orange this week, and the number of counties seeing significant increases in cases and exceeding the CDC's threshold for high incidence. Remember that is based upon a 2-week period of time per 100,000. That number of high incident counties has grown from 17 to 21. 70% of Ohioans are now living in an orange county. We have 5 red counties this week, the lowest number of red counties we've reported since starting the alert system. So good news in regard to that lowering of the red counties, but the high incident counties, we're seeing a number of those, as I said. Red counties this week are Butler, Mercer, Montgomery, Portage, and Putnam. Let's talk about what we're seeing in our red counties. We'll talk at, we'll go in the order of where they are the highest number of cases per 100,000. Putnam County, it would be number 1, 256 cases per 100,000 in the past 2 weeks. They continue red for the 3rd week because the county meets that CDC's threshold for high incidence, which is 100. So they're well over that. They're 2.5 times that. Their average daily emergency department visits grew from 1 on August 26th to an average of 3.5 on September 4th. In August, more than 40% of their cases were with people between 50 and 69. Local health department officials attribute high case numbers to several larger social gatherings, including many weddings. They also said there's spread in households from one family to another, one member to another. Mercer County would be the second one of the red counties. They're at 240 cases per 100,000. That's the 7th consecutive week for Mercer County. They've had 99 new cases, actual cases during the past 2 weeks. And in a press release yesterday from the Mercer County Public Health Department, they said that the county had 19 new cases reported during the preceding day. So that is very, very concerning. Mercer County Health Department reports that the growth in cases is not attributable really to nursing homes, but rather the spread continues throughout the county. Butler County, they are at 182 cases per 100,000. They remain red because they meet the high incidence threshold, which we said is 100. Miami University continues to impact case numbers, even though the cases on campus are dropping. I talked this morning to Randy Thomas at Miami. Randy went through the figures with me, and what we're seeing is, frankly, a real decrease in some of these numbers. So we're happy about that. But what we're seeing at Miami is what we're seeing at other universities, off-campus activities, not what's going on so much on campus, but off campus continue to impact the county's number of cases. Montgomery County, they are at 139 cases per 100,000. They've been declining during the past few weeks, which is good, with cases per capita declining from 178 to 139. Montgomery County is the only county to trigger the COVID hospitalization indicator. Their hospitalizations went from an average of 4 per day on August 31st to an average of 7 per day on September 13th. Cases with the University of Dayton have also stabilized, as they have at Miami, so we're happy to hear that. Let's go to Portage County, home of Kent State University, is new to the red level this week. The county's average daily cases have increased from 5.5, an average of 5.5, on August 26 to almost 11 on September 4th. Portage County also seen an increase in average daily outpatient visits from an average of 6 on September 10th to an average of 9 on September 15th. The majority of cases are being driven by activities in off-campus housing and to a lesser degree Greek housing. So far in September, 51% of Portage County's cases are in people who are younger than 29. Eric, let's go and look at the high incidence counties. As I said earlier, the number of counties with cases that exceed the CDC's threshold for high incidence is now at 21. New counties added to this list are Athens, Delaware, Greene, Harrison, and Pickaway counties. A reminder that this number is important because it means that cases are rising steadily in a county. Even if the county doesn't meet one of our other indicators, they still have a significant number of the cases. Having high case numbers increases the chances of the virus spreading throughout the community if steps are not taken to slow this down. So let's talk about a few of those counties. And again, this is a list of the top 20 counties. Putnam, these are in order: Putnam, Mercer, Athens, Harrison, Shelby, Butler, Henry, Franklin, Miami, Montgomery, Auglaize, Delaware, Warren, Lawrence, Dark, Clark, and Greene, Pickaway, Meigs, and Wood. So those are the top counties based on number of cases in the last 2 weeks. Let's talk a little bit. Let's go to Athens County. Ohio University students are certainly impacting the county. Outbreaks in Athens have been associated again with off-campus activities. Harrison County. In the past 2 weeks, has 29 actual new cases, and they've had a total of 60 since the beginning of the pandemic. So you can see that was a county that didn't have a lot of spread, and now it's just bam. Moved right up in the last 2 weeks. Health department officials in Harrison County tell us about half of the recent cases are from a long-term care facility outbreak. Delaware County, they have had 366 new cases during the past 2 weeks. Half of those are people who are younger than 30. Greene County had 100 in the past 2 weeks, 180 cases during the past 2 weeks. Of those cases, 48%, about half, are younger than 30. As you know, Greene County has 5 colleges, universities here. Pickaway County has had 85 new cases during the past 2 weeks. Eric, let's look at the slide So this is a summary, and let me just get to that in a moment. Let me talk about some stories here. We try to do this every week, and again, not to shame anybody, but really it's just to try to understand about how this spreads and how easily it does. This is spread associated with a funeral in Jefferson County. 7 people are sick, at least 22 have had to be quarantined. The people who are quarantined are in 2 different counties, and the people who are sick are in Ohio and in West Virginia. In Cuyahoga County, 8 high school volleyball players tested positive for COVID. A few of the players attended a large graduation party a couple of weeks before they started feeling sick. So again, I know people are asking about sports and they're asking about what's going on in schools, but by and large, from what we can see, it is other events. It is not the sports competition, at least so far, that we're not seeing much in, but it is students having parties and doing other things. We have a couple of new dashboards that we want to share with you. Our kids obviously only have one opportunity to grow up. And it's up to us, the adults, to ensure that they have every opportunity of a bright future. So let me look at look at some of these. And Eric, I forgot to go through the map. You want to go back to the map? This is a map we haven't shown for a while. This one over here, and what you'll see is the red. These are the red counties that are outlined in red. And we believe, although we may be behind in some of the data, but the color, fully remote is the dark blue. Hybrid is the light blue. And for those schools that are fully back 5 days a week, it is in this more white or more whitish color. And so what we've done is just circle these. So you can see in some counties, they're mostly remote. You can see other counties that, they are totally open. And again, the only reason to show these is just encourage people in those counties, try to do everything you can to keep the COVID out of the school, keep your kids playing sports, keep your kids in school. That's where we're seeing, the red counties. So let's go to the next one, Eric. So this is our first school dashboard. On September 3rd, the health director signed an order establishing a reporting process for schools when they have COVID cases. In addition to notifying parents, schools are required to report COVID cases to the local health department, who then reports them weekly to the Department of Health. And so this is how it looks. And you'll be able, you can go, I believe it's up now, or will be up sometime today. You'll be able to go to the county and you'll simply be able to see how many cases in the last week, how many cases that are cumulative. So those numbers will change. I believe the only schools that are up are the schools that have had incidents of COVID. And again, I want to just say this because I think it's so very, very important. Because there's a student who's associated with a school who has tested positive is no reflection on the teachers, the principal, superintendent, or anybody else. School could be doing absolutely everything right. The school is going to reflect what is going on in the community. The fact that they have figured it out, the parents have, the school has, that this student has COVID, and they've taken the appropriate action in working with the health department is a positive thing. And so we should look at that as a positive thing. And again, schools, from what I can see in talking to superintendents and reports I'm getting back from parents, I think are doing a very, very good job. But this is just one more effort to share information about what's going on in regard to COVID. Most important thing is that parents in that classroom where that child was, or parents who have children who have been close in contact with that child, certainly they're the first ones to get notified, and that's the most important thing. Let's go to the children's dashboard. This is a separate dashboard. The next new dashboard is focused on children and COVID. It was created in consultation with the Ohio Children's Hospital Association. We are blessed in Ohio with some amazing children's hospitals. Sometimes we take them for granted until we have to take a child there or a grandchild goes there, and then we realize how lucky we are to live in Ohio with so many great children's hospitals. The dashboard includes information about cases, hospitalizations, and deaths. One of the more troubling statistics, and there are a lot of statistics, and I'm going to ask Dr. Manning in a moment to kind of, I've asked her to take a look at this, and you've heard from her before in these press conferences, but she will kind of, I've asked her to take a look at the statistics and kind of report what she's seeing on there. But these will be available to the public today. One of the more troubling statistics when you look at this data is that Black children make up 45% of all hospitalized children out of those children who in Ohio who've gotten COVID. But only 18% of the total population under 18 is Black children, African-American children. So that is, again, a disturbing figure. Dr. Manning, thank you for joining us. Are you on there? Thank you for coming back, and we appreciate it very much.
Here, yes, thank you very much for having me, Governor. I'm really excited about this dashboard and the ability for families and pediatricians to see this kid-specific data. You know, and you've been a great steward of the fact that data really builds trust through transparency. It helps people feel informed. It lets us know how we're doing as a region, as a community, as a school district. And the data that's on the dashboard currently really reflects the experience that we've had across the state as we come together as children's hospitals through the Ohio Children's Hospital Association. You've heard me share before that we're incredibly fortunate that children do not seem to get very ill with COVID, but they do get COVID. And the data really reflects that. We have fairly consistent numbers of children positive with COVID, but fairly also consistently low numbers of children who are hospitalized or who are severely ill with COVID. You know, and finally, the last thing that this data really helps us do is it helps us track trends over time. We want to know if this is going to change. Again, we've been fortunate over time that the trends have stayed very low for children, but if that changes, the only way for us to know if that's changing is if we track that data over time.
Well, Doctor, talking about that, we've been at this 6 months, and I know you've been watching this very closely, not only watching it, but dealing with patients. What have we learned, and you talked about it a little bit, but what else have we learned about children during this period of time, or maybe what don't we know?
Well, we do know that children who are older and more mobile and more social tend to be more likely to get COVID. We do know that children, as they get older and have other health conditions, could be more seriously ill. We also know that children can be asymptomatic with COVID. And that, you know, that specifically strikes a lot of fear for people, I think, that there might be lots of children walking around carrying COVID. But, you know, on the reverse, we also know through testing thousands and thousands of children in Ohio before they go into surgery or have other procedures, children who are asymptomatic, we know that the percentage of those children that have COVID is exceptionally low. It's about 1%. And so even though we know that children can be asymptomatic with COVID, you know, the overwhelming majority of children who are walking around without symptoms do not have COVID, which is very reassuring. And finally, we're learning and experiencing right now as kids go back to school that the practices that we've discussed before, the safe practices of wearing a mask, keeping some distance, using hand hygiene, and cleaning surfaces, we know that those things keep kids safe. And if kids are safe, the adults in school are safe. And if kids are safe, the adults at home are safe. So it's all connected.
Well, that's great, Doctor. Thank you. And so for a parent who's not a doctor, let's say, and who wants to look at this, what do you look at, and how can you use this? How can this inform anybody who's watching today?
So I would tell parents of different age children, look at the data as it's broken down by age groups. That's incredibly helpful. And again, you'll see that in certain age groups, the rates tend to be a little higher. I would tell parents to look at the region in which they live so that they understand what disease is like in their community. As you've said, that what's happening in the community really impacts what happens in the schools. And then if and when we have data that's school specific, I know that families are really, really hungry for that kind of data. It reminds me of the data that we shared within our health systems early on, that we were all hungry for. We wanted to know how many patients were positive, how many staff members might be positive, because that informed how we move forward. And finally, I would really emphasize that this data is so critically important for primary care providers and pediatricians. Pediatricians always have their finger on the pulse of what's going on in the community. They're always aware of what's going around, whether it's strep or flu or things like that. And now this really enriches their knowledge even more, so that if somebody were to go to their pediatrician and that pediatrician knew that COVID was occurring at different rates in that age group or in that region, that would really impact how they would practice with that family and that child. So lots of richness in this data.
Great. Let me just close with one last question. We had reported yesterday a case of flu. It was an adult, it was not a child, in Putnam County. So we're getting into the flu season, and I wonder, what is the protocol, what's the recommendation in regard to children as far as flu shots?
So thank you so much for referencing that, Governor, because it's so important this season more than ever that children 6 months and older can get a flu shot starting now, starting today. This is the time to do it before the season's really busy, before so that you have a chance to develop your response. You really don't want to be the parent of the child who experiences what it's like to have a child who has flu and COVID. We don't want to learn what that is. We may have to learn that, but we shouldn't have to learn that, because a flu vaccine is so helpful and so preventative. So go today, start today, contact your pediatrician and get your flu shot.
Doctor, thanks for joining us again, and we hope to bring you back if you're willing to in the future. We appreciate it.
Absolutely.
Thank you very much. To continue on what Dr. Manning said last week, Fran and I got our flu shots. John got his flu shot. And as Dr. Manning said, it's critically important to get a flu vaccine this year. We are now into the season. Even though the flu obviously cannot protect you from COVID. As Dr. Manning said, this is not something that any of us, adults or children, want to learn about how COVID and the flu together work. Not something we want to see. The flu shot's another layer of protection to keep yourself, your family, those who you love and who are around you healthy. Getting the shot helps reduce your risk of spreading that flu. It prevents strain on our healthcare system and our healthcare providers, keeps our workforce healthy. It also can keep you from getting really sick. And one of the things that the doctors tell us that if it doesn't totally prevent the flu, it may decrease the severity of that illness, which is so very important, and particularly important this year when the COVID is out there as well. Flu shots are available at your doctor's office, retail pharmacies, federally qualified health centers that we have throughout the state also have the flu shot available. So one of the things that I've enjoyed doing, I hope you have as well, is hearing from some of our superintendents out there who are doing something that superintendents have not had to do for 100 years, and that is deal with a real pandemic. And I think they're doing a very, very good job. First up is Justin Jennings, Chief Executive Officer of Youngstown City School District. Jennings, you on there?
Yes, sir.
Well, thank you for joining us. We appreciate it very, very much. I see a couple of football helmets back there.
Absolutely.
It is football season. Tell us how you're approaching what's going on in Youngstown schools. Are you all remote? Are you in person? What are you?
Yeah, we decided to go remote about 3 months ago. So we are working through the remote system. We have all of our devices, and we've started, and we've also allowed, we have allowance for all of our scholars to have a hotspot or to have hardware wired internet access.
So I think that's very, very important. You told me when we were talking the other day that you all made that decision early. Then you started, one of the challenges we always have, and certainly we had in the spring, was students in rural areas, but sometimes also in urban areas, might not have the connections. They might not be able to, have a laptop or some way to pull that down. So you've taken care of basically 100% of your students out there, you think, who now have the ability to connect in?
Yes, yep. If they have hotspots, we try to provide one for each scholar at the house, because we know sometimes if you have 4 or 5 people on the internet at the same time, it doesn't run as fast. And if they didn't have anything, we provided a home from Spectrum. We provided a home internet access for them. So,
Tell me a little bit about how your teachers are doing, and you know how this learning is going.
well, because we started so early, it afforded us the opportunity to train our teachers in the summer. So it's still a learning curve. Zoom is new for everybody. I mean, I don't think anybody, you said you wanted to be an educator early, I don't think they had a class on remote learning. So this is something that's kind of a learning curve for all of us. And the teachers have been very positive, more for their health and safety. It has been something that's been really positive. We're still allowing our teachers to work from home, or they have the choice with social distancing to work from their classroom.
Tell me a little bit about wellness dollars. One of the things that the legislature provided, and you know, we came up with this proposal, sent it to the legislature, they embraced it, was the wellness dollars. And you and I were talking the other day a little bit about that. You want to tell us what you've done with those? And because I thought that was it was unique what you're doing, really.
Absolutely. I mean, we know that health and wellness is really something that's positive that comes out from this COVID virus, is really looking at the disparities in our healthcare system. And one of those things for Youngstown City Schools is we don't have any pediatricians within our city limits to service our scholars. So what we decided to do with our wellness dollars is we've teamed up with Quick Meds and Dr. Ishmael, and we're going to have a clinic in each of our high schools that is going to be open from 10 to 6 every day during the week, and on Saturdays as well, to service our scholars and our community as well. And as of yesterday, after our press release came out, we're also going to have vision there as well. So Dr. Siegel from Sight for All will be there as well. And that's an opportunity for us to do this. And our plan in the future is to be able to expand and have a clinic at each school to service not only our scholars and teachers, but our community as well.
Wow, that has to have a huge impact when that's all online. Huge impact not only with the students, but with their families and other people in the community.
Absolutely, absolutely. We have a large percentage of our scholars who have family members who have been incarcerated. So when they come out, they don't have the opportunity for that health care as well. So we're going to provide it for them as well.
Well, I think that's really exciting. What's the timeline on that? How soon does that kick in?
We'll be open and ready for business in late October, early November. So we're just getting the space together, and then we'll be good to go. Maybe a little earlier than that.
So with the students remotely, though, you're still going to open this up for students to come in and for community members.
Yes, by appointment, we'll be prepared. We'll follow all those guidelines that we have normally with the social distancing, with temperatures and different things like that. So we've actually been using QuickMed to do our testing for all of our scholar athletes, our COVID testing. So that's kind of how we started the relationship.
Well, that's great. Thank you very much. I was really excited about that when you and I talked the other day, and I wanted you to share it with everybody in the state. So thank you very much. Good luck.
Thank you.
Good luck to your students and your teachers. We thank them for all they're doing. Next, I've invited Greg Enninger, the superintendent of Vanguard Sentinel Career and Technology Centers. They have campuses in Tiffin and Fremont. Thank you very, very much for joining us. We appreciate it. You've got most of your students back on campus now, do you?
We do. Thank you for having me, sir, Governor DeWine. We do. We have about 1,051 kids on campus. We did start the school year on a hybrid system. Our goal from the start of the end, really, of last school year was to do whatever we needed to do to open school with students on our campuses. We really believe that career tech education is instrumental in our community in providing a trained workforce. And we think that really became, really apparent during the pandemic when you saw the workforce that were deemed essential. There's just about every career field that we have students training for. And to properly train them, eventually they have to get into the lab, they got to practice, they got to demonstrate, they got to do that hands-on portion, which is paramount to their overall skill development of their career, and to have that ability to pass that specific industry credential. So we really did put in a lot of safety requirements. We followed the state requirements. We followed industry sector specific requirements if they were above and beyond what the state had put out. We really felt that was important to stay in line with business and industry because that students would be seen in their early placement opportunities or full-time job opportunities. So then we decided, we basically created 3 schedules that tried to hit every scenario that we might face. We did do it all students back, a flexible hybrid that reduced kids to 50% capacity, and a full distance remote learning if we had to. But as I said, there's only so much online related work you can do with the hands-on and the career tech. But we did start in a hybrid system to give us the ability to kind of start slow. It was new for staff, making sure all the social distancing was taking place, the face covering, the hygiene pieces were all being followed. And then what we did look at, Governor, was we didn't look at every lab the same. I mean, every lab is a different size. Every enrollment might be different. So we kind of took the approach of if we can continue to maintain the safety requirements, our goal was to get students back fully. And we were able to do that. Actually started this week, 4 days a week. We have all students except for in 3 labs that we didn't feel like we could maintain that safety requirement. So we kept them on the hybrid. Everybody else is back, and we left the Wednesdays as a distance learning day for staff for additional planning and for us to be able to do an additional deep clean above and beyond what we are already doing.
So you've had to really approach this as a school, but also as a business or a manufacturing company or whatever the skill set is. So you've had to pull best practices from industry plus best practices from schools. So that's been an interesting challenge, I'm sure.
Absolutely. Yeah. If you would walk in a few of the labs, such as our cosmetology or health lab, you would see a double barrier system because that's what's happening out in industry. They have their face mask and a face shield on. So they are following them, and staff is doing an outstanding job. Even when they came back with even more ideas of how they could create a more safe environment to get the students back on a full-time basis versus a hybrid. So it's been a great start thus far.
So I know this has been a difficult time. Your instructors, how are they doing? Your teachers, how are they doing? How are the students doing?
Yeah, the students, I'll tell you, everybody really bought into the safety. We haven't had any major issues with that. Staff, like I said, has just been outstanding with getting their labs and classrooms ready and prepared for students. They all wanted to see the students get back on campus as well. And without that proactive approach, I think from our staff and knowing what they need to do inside lab, portrayed to getting the students back full time on those 4 days. So I think everybody's doing really well. The kids are working hard and getting those skills that the employers need to meet the job outlook.
Well, that's great. Well, thank you so much for joining us, and best wishes to all your team. Thank them for their hard work, and thank the students for their hard work.
Well,
Appreciate you being with us.
Thanks for having us. Appreciate it.
Thank you. Since the start of the pandemic, we've worked hard to make sure we are protecting Ohio's critical infrastructure workers who keep food on our tables, keep us healthy, keep us safe. Indeed, our critical infrastructure is part of that. And some of the most important people are migrant workers, our seasonal workers. We've been working with local health departments across the state to monitor and assist when outbreaks occur on the farms where they work. In Ohio, there are currently around 5,600 known migrant and seasonal workers who work at camps licensed by the state of Ohio. Many owners and operators of these camps also provide housing for workers and their families. This creates kind of a unique situation for these communities where individuals are working, traveling, living together, often in very close proximity to each other. Now, these unique circumstances have created a situation where workers and their families are many times impacted by this COVID virus. Since the beginning of the pandemic, we've been reaching out to these communities to help with testing and translation services, outreach, providing materials in English and Spanish to help workers stay safe from COVID-19 at work, at home, and in the community. We know that when COVID-19 outbreak occurs, when one of them occurs, a swift, coordinated response can significantly reduce spread and help those that are sick get the care that they urgently need. We're going to today release our rapid response guide for migrant and seasonal farm workers to support local health districts in developing a culturally appropriate plan to respond to an outbreak. The Department of Health has an interesting kind of diagram or chart, which I did not bring, nor do I have in front of me, but it shows that how seasonal workers come in at different periods of time, basically starting in March. And so it's an ongoing process. And so, you know, it's not going to be too many more months until that process is starting again. So we're glad to get this document out. It's part of what we have been doing. It will be available on our website at coronavirus.ohio.gov as part of our continued efforts from the Minority Health Strike Force. In addition, to help meet the needs of the farm working community, the Ohio Department of Health is awarding $2.6 million in CARES Act funding to agriculture camp operators to improve the health and safety of their work sites and camps to reduce COVID-19 transmission. Those improvements will primarily focus on reducing housing density, installing touchless equipment, partitions, and hand washing stations. The Department of Health is also partnering with the Department of Jobs and Family Services to distribute face masks, hand sanitizers, disinfectant cleaner, digital forehead thermometers to workers and operators. By helping provide these prevention tools and providing information, we know that this will help slow the spread. A quick wastewater update. Since mid-July, Ohio's coronavirus wastewater surveillance network has been monitoring incoming waste at wastewater treatment plants around the state to test for gene fragments of COVID-19. Our team, along with university researchers, has seen a recent steady increase in the number of viral gene copies at 2 wastewater treatment plants. One is in Dayton. The other is a Columbus plant referred to as the Jackson Pike plant. These findings are information that we very quickly pass on to the local health department. Many times the health department is directly involved in the gathering of this data. But the point is to get it to the people who can use it right on the ground. The Ohio Department of Health notified in one case the Dayton Montgomery Public Health and the Columbus Public Health systems to allow them to take appropriate action. Again, one more piece of information, and we think as this continues to evolve, it's going to provide more and more better information. Testing of wastewater for COVID-19 gene fragments can also be done on a smaller scale to focus on targeted locations within a treatment plant service area. For example, the Ohio State University has started monitoring 6 separate locations on campus. Samples collected are being used by Ohio State alongside rapid student testing that they're doing to better track COVID-19 on campus. The goal is to use these 2 data sets to identify possible infection spots. That's what Ohio State's doing with those 2 rapid student testing as well as the samples that we're talking about. We are currently testing in more than 30 cities across the state. We'll expand testing to more than 50 locations in the next month. We've got a lot of questions about Halloween, and we will be putting out some guidance tomorrow. And so you can look for that actual guidance tomorrow. Halloween historically in this state has been a very community event. Beggars Night has been a community event. And communities set the time themselves. They make the determination about that. So that will not change. The local community will make the determination if there's a Beggars Night, when that Beggars Night is. They will do that, I'm sure, in consultation with their local health departments. Parents, in turn, will do what parents do, and that is make a decision about whether their child goes out in trick-or-treating. Obviously, celebrations this year will not look like those in years past. Again, face coverings, and of course, that may not be a problem with trick-or-treaters who are wearing a mask and something else, but it's important to have some mask on. Hay rides, haunted houses are much more problematic. Again, we kind of come back as you look at these things and look at how close you are or your children are going to be to others, many times here strangers, how close they're going to be. Do they have a mask on? Do the other people have a mask on? And how long in proximity does that last? So when you look at, for example, the haunted houses, probably much higher risk than the normal trick-or-treating, just because of the close proximity inside those haunted houses. So we'll continue. We got a while to go until Halloween. We're going to put the initial guidance out for everyone because we're getting a lot of requests about that. As the virus evolves, again, we will continue to update that if that is in fact appropriate. And again, in making all these decisions as parents, you make those decisions based upon all the information that you can get with our color coding and all the other things that we're providing. One of the factors obviously is how much spread is there in your community. And so that's again something that you can consider. So we'll be having more information about that. As I said, we're going to put a release out tomorrow and just kind of outline the recommendations from the State Health Department. Today, I'm pleased to announce that the Ohio Department of Jobs and Family Services has now begun distributing the $300 per week in lost wages assistance to eligible unemployed insurance recipients. So you should be starting to get those checks. Those checks will go back in time for whatever you are eligible for. This assistance is available to Ohioans who receive traditional unemployment benefits, pandemic unemployment assistance, trade readjustment assistance, shared work Ohio, or extended benefits for weeks ending August 1 through September 5. PUA claimants are receiving these payments first in a staggered manner with individual payments for each week they qualified for the program. For those receiving other types of unemployment benefits, the necessary system program update is underway. When it's complete, individuals will need to log into their accounts to certify that they were unemployed or working reduced hours because of COVID during eligible weeks. These individuals receive one retroactive payment for all weeks that they qualified for. Jobs and Family Services staff are working to complete this programming as quickly as possible, and they're posting frequent updates on their website at jfs.ohio.gov/LWA. So that's will be coming. If anyone has questions, they certainly can contact Jobs and Family Services, but I wanted to tell everyone that these checks are starting now out. Today, we want to remind everyone about the census, and so we have asked Lydia Mahalik, the Development Services Agency, who is in charge of the census in Ohio, to talk with us. Lydia, thank you for joining us. I know you're working very hard on the census. Tell us how we're doing in Ohio.
Well, good afternoon, Governor. Yeah, actually, the state of Ohio is doing well. As of this morning, our self-response rate is 69.9%, which is the responses from Ohioans either over the phone, online, or by mail. And this actually happens to be above the national self-response rate. Our total response rate, which includes the census door-to-door efforts that are happening right now, is actually 95%, which is above our response rate 10 years ago. But I got to tell you, in our self-response rate, Governor, we're still behind the state up north.
Well, we don't like that. So
You don't.
they're within striking distance, though, I believe.
That's absolutely correct.
We're within striking distance. So
that's right.
So what do people need to know? If you've not filled out a form, if you've not gone online, if no one's knocked on your door, what do they need to do?
Right. Well, right now you can actually complete your census today by either going to 2020census.gov or by calling 1-844-330-2020. Really easy to do. The census is safe, it's easy, and it's so important.
Director, thank you very much. We appreciate it. I like the flag in the background there. Looks
Only
great.
the best from Flag City, Governor.
Flag City. All right. We appreciate it.
Thank you.
Very much. We're ready for questions.
Governor, our first question today is from Kevin Landers at WBNS in Columbus.
Hello, Governor.
Hey, Kevin.
Several weeks ago, I asked you if you would be returning money that you received from First Energy. Have you been able to identify how much money you received from First Energy? And if so, where did you return that money to? You said you were going to donate it to charity.
I will check with that. As I recall, we gave that money to food banks in Ohio, but I'll confirm that with Laurel and my team and make sure that we get you that exact information.
Next question is from Jeff Reddick at WSYX in Columbus.
Good afternoon, Governor. A newly released report that was obtained by ABC News coming right from the White House showed that Franklin County is still a county that is of at least some concern, if not major concern, for the federal government. Franklin County, of course, on the state's kind of color-coded heat map has gone down and remained in orange. But I'm wondering if you still have great concern for Franklin County as it leads the state, or if that orange level is in any way, if you think, dissuading people from taking the necessary precautions.
Well, we asked people to look at two things. And I don't know, Eric, do you have the ability to put the top 20 back up again? We look at two things, and we ask them to look at two things because you can't get a picture by just one set of statistics. It's like a baseball player. You know what they batting average, but if you don't know runs batted in, and et cetera, then you don't have the full picture. And so we try to give them as much information as we can. If you look on here, Franklin County has, I can't remember what Franklin County number was, but I have those numbers of incidents, but their incident numbers has continued to stay high. So we are concerned about that, and we remain concerned about it. So, you look at two things. You look at the list. You look at the color code. So, I mean, one thing the federal government has, they go by positivity, which is an interesting number per county. We hope to have positivity numbers up for every county shortly. We think candidly that the federal government's positivity numbers are not always as precise as they could be because my understanding is they are using the hospitals. So my understanding is that if someone comes out of Circleville, they're in a Franklin County hospital, that would be attributed to Franklin County. So we don't think those numbers are exactly right, but we do agree with the federal government that there is certainly a concern with Franklin County. And look, a lot of this we're looking at a lot at what's going on with thousands and thousands of students who are back in school. What we continue to see, I think our schools are doing a good job. Ohio State, who's the biggest one, obviously, in Franklin County, I think is doing a good job. The testing, the tracing, but what we continue to see at all universities is off-campus and off-campus activity. And so we worry about that as well. But the mayor and I talk a lot. We talked earlier today, and we continue to stay in very close touch as we do with the two health departments.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Good afternoon, Governor.
Hi, Joe.
Hi. Candidates are starting to come to Ohio. We saw Vice President Pence here recently. President Trump is coming. And then the Democrats, we're probably going to start seeing more of their, events in Ohio. These typically draw large gatherings. And if you look at the crowds on some of these gatherings, they're not masked. They're not wearing masks. There's a mask mandate in effect in Ohio. My question is, are you going to enforce that mask mandate at those kind of events?
Well, Joe, let me kind of go through this. Throughout this pandemic, we have not put orders on, we've not closed churches. Other states have closed churches. We have a great respect. I have a great respect for the First Amendment, great respect for freedom of religion. While we have urged churches to have, people be very, very careful, we never closed them. The only thing we've done with churches is to require masks by a person who's not the celebrant or person who's not talking. So we've done that. In regard to demonstrations, and I know some people were irritated with me about this, but we said, look, this is an exercise of First Amendment. Now, at the same time, we said, please, please, please wear a mask, keep a distance. And every time we continue to talk about that. Political campaigns, whether it's Joe Biden, whether former Vice President Biden, or whether it's President Trump, or whether it's a local candidate, if they're having a political rally, we exclude them from that order. But we really urge anyone who's conducting a rally, anyone who's attending a rally, while we don't require you to do it, the order does not say you have to, but please wear a mask. Please do social distancing. What you don't want to see is in any event, whether it's a wedding, a funeral, whatever it is, it become an incident where someone gets sick. And so, again, any candidate who comes into Ohio, any candidate who campaigns in Ohio, please do everything you can to have everybody wear masks. And for the people who show up, and we would just ask them, please wear a mask. We think that is just, it's just absolutely vitally important.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hi, Governor.
Hi, Ben.
I have a question here sent in from a WCPO viewer. This viewer says her father is in a nursing facility and that she's sent countless emails to your office and other state agencies asking to see some change in how nursing facilities are handling COVID-19. In this viewer's words, she asks, quote, what is visitation going to look like going forward? Within a month, it's going to be too cold outside to have outside visitation, end quote.
Yeah.
This is just one of a number of concerns raised by our viewer. So I guess the overall question is, moving forward, how will we see rules and guidelines regarding nursing home visitations evolve? And could we expect to see any more lenience on visitations in any way?
Well, we get these calls, and my heart goes out to anybody who's not being able to visit their loved one. For a number of months, we have opened up nursing homes as far as the state's orders, the health orders. We've said they can provide visitation. We suggest and say that it should be outside. We know that winter will come eventually, much as we don't want it to come. And so we're now working on how visitation can take place inside. If you have a loved one and you cannot get into a nursing home, that it is the nursing home that is stopping you from going in. It is not the health department. So again, they may have a reason, they may have a good reason, but it is not the health department. We have, for a number of months, said people should be able to visit loved ones in a nursing home. Now, look, we don't want anybody going in there, visiting who's sick. We want them doing it outside. We want them to wear a mask. So, those are normal precautions that we, know should take place and expect to take place. But I continued also to get calls. I continue also to get texts and emails from people who say, I can't go visit my loved one. And, again, that is something that we are not stopping. That is the nursing home that is not letting you in. And now, as I said, they may have a good reason, but you should contact that nursing home and find out what that is.
Next question is from Max Philby at the Columbus Dispatch.
Hey, Governor.
Hey, Max.
Just looking through the school database put out today, it looks like most of the data is on the district level. And considering the fact that some of these school districts have dozens of different schools and buildings, wouldn't it be more helpful to list it via building as opposed to district-wide?
Well, we get into the question, and we discussed this before. I don't know whether you and I have discussed it, but the issue about the law saying that you cannot put out information that would identify someone as having COVID or identify anything about health issues around one individual. We've always felt that the most important thing was that parents of children in that school be notified. So they are being notified. First of all, the parents of any child who came in contact with that child, who was sitting with that child, anything else, those are the first people that should be contacted. And to my knowledge, are being contacted by our schools. Second, if you have a child in that building and there's some COVID in that building or a child has COVID, you're supposed to be notified. So those are the people who have the most, seems to me, important that they in fact be notified. We've encouraged schools to put dashboards up so that anybody in the community can look up and find that out. But we can't micromanage this. And we can't micromanage it down to the point where in a small school system, they might be giving out information that would identify someone as having COVID, which is illegal. They cannot do that. We cannot do that. I cannot require them and should not require them to do that. So what we said at the beginning, and we had people in schools who said, this is too burdensome. We had other people, in the press who said, you're not giving us enough. We're going to let this run for a few weeks. We're going to kind of see how it works out. We're going to see how the information is flowing out. And then, if it's appropriate to adjust it further, we will certainly do that. But, again, our goal throughout this has been put out a lot of information. We've been focused most particularly, though, on actionable information, something you can take and do something with that piece of information. But we're trying to get as much information as we legally can get out.
Next question is from Laura Hancock at cleveland.com.
Thanks, Governor. Two quick questions. Convention centers are still not allowed to operate in Ohio as like their normal intended way. Any update on when gatherings of more than 10 people might be allowed in convention centers? And then the second has to do with the school dashboard. Is the data helpful when it contradicts what individual school dashboards are saying? Cases on the state dashboard seem to be far fewer than what schools have previously reported. For instance, in Cuyahoga County, health officials announced 51 cases in individual districts, up from 23 the previous week. The state's dashboard is only showing 3.
I'll check on it. Look, this thing went live today. There's bound to be problems. We're going to fix the problems. Keep in mind that this goes through Sunday. And so the data would be relevant as of Sunday. If somebody makes an announcement of something happened Monday, Tuesday, or Wednesday, then it would be different. I don't know if that's the situation here or not, but we certainly will run everything down. We have no incentive not to have accurate information, and we're going to try to make it accurate. But again, a lot of schools, 600 some school districts, a lot of reporting coming in. We'll check on it. If there's discrepancies there, we'll try to run those down.
Next question is from Spencer Hickey at Hannah News Service.
Thank you. This is for the governor and Director Mahalik. If you'd be able to answer this. You talked about the census rates statewide. Would you be able to comment on rates for regional areas, particularly Appalachian and southeastern Ohio, and if there's continued state efforts towards those areas?
Yeah, is Director Mahalik still on the line, Eric?
Yeah, I'm here, Governor.
Okay. Could you hear the question?
I could, yeah. And I don't have those rates specifically with me right now, but we'd be happy to get you that information.
We'll get it.
Is there state efforts specifically to promote the census in those areas? Director, you're muted if you were saying something.
Yeah, absolutely, Spencer. We're doing everything to promote the census statewide. We've actually worked with our partners in the Appalachian region to do some media awareness and those types of things. So, the state has its entire Complete Count Commission, but there are Complete Count Commissions all across the state as well in different counties and cities. And there's certainly been an effort to ensure that we get those hard to count populations that you're referencing aware of the census. And in terms of what that percentage looks like, we'll have to get back to you on that.
And Lydia, I wonder if you could, Director, if you could talk about the door-to-door, because door-to-door is one way that you try to reach those folks who you haven't reached any other way. How does that work in Ohio? What are we doing?
Yeah, well, right now, the census actually has census takers out amongst the different communities, and they're stopping by doors of individuals or households who have not yet responded to the postcards that have been sent, reminders that have been sent over the last 6 or 8 months. And really, they're going door to door right now. They're wearing masks. They have, government IDs that identify them as official census takers. They're all following the proper health guidelines. And I would say if no one's home, they will put the information at your door so that you can go ahead and go online or call the phone number to respond to the census.
And if someone has, let's say you've got a family member who maybe just moved, they moved in from another state, how does that person get contacted?
So the best thing for that individual to do is to either go online to 2020census.gov or to call the phone number, which is 1-844-330-2020.
Director, thank you very much.
You're welcome, Governor.
Next question is from Jim Province at the Toledo Blade.
Hi, Governor.
Hey, Jim.
Last night, Vice President Mike Pence urged the crowd in Zanesville to applaud you for your performance as governor, but many in the crowd responded with boos. Why do you think you're getting that kind of a reaction to many within your own party? And do you plan to attend the president's rally Monday night in Toledo?
Yeah, he may be another location in Ohio. I hope to be with him. I don't think they've announced the second location yet. And I tend to be with him at the second location, so I won't scoop the White House, but I think there's going to be another announcement unless things have changed in the last several hours. And so I would intend to be with him then. Look, as far as why some people in the crowd reacted the way they did, look, it's we're making tough decisions, or we're making decisions, and we understand that this is a tough time. We have some people who are unemployed. We have people who, don't want to wear a mask, and a lot of different things. So I'm going to continue to focus on what I need to do. I think that's my job. I think that's what people elected me to do, and we'll keep doing that.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you for being here. Obviously, President Trump will be here on Monday, which many are talking about, and many in Ohio are concerned with a large crowd getting together that he normally draws, no matter the candidate that could be coming to Ohio over the next several weeks before the election. Are you concerned what these kind of rallies could do with our numbers, especially considering Ohio is already dealing with schools going back, colleges going back, possible flu coming up, and the spread that we're seeing in our rural areas?
Well, no matter who is putting on an event, our answer is the same. And that is, if it's protected by the First Amendment, it's protected by the First Amendment. But we urge everyone to wear a mask. We urge everyone to keep their social distance. We know that gatherings, by their very nature, can lead to spread. We know that. That's a fact. And so the basics have not changed. We also know that outside, or a place that's well ventilated is obviously better than inside and there's not the ventilation. So, they're all the variables that we talk about, and we just, no matter who's going to have an event, whatever that event is, we would just, whether it is related to a campaign or not, we would ask people just to be very careful. This is a time when we have, as you saw by the map, we have spread all over this state. And we're seeing more and more in these counties, go from yellow to orange. And that's not a good thing. We're hovering at about the same number of cases, a little over 1,000 cases a day. Our positivity number is pretty good. It's been going down. We're very happy about that. But we also know that winter's coming. And things, some of the scientists predict things get rougher in the winter as far as the virus. So we carry on. We just ask everyone, keep the essentials in mind. Distance, mask, outside better than inside. So.
Next question is from Jack Windsor at WMFD in Mansfield.
Hey, Jack.
Hi, Governor. On Tuesday, I cited the federal case in Pennsylvania, and asked you if Ohioans needed to earn their freedoms. You said our rights are God-given and government powers are not unfettered in halting them. Yesterday, Representative Grendell announced a bill that seeks to lift the state of emergency in Ohio and existing healthcare orders. Grendell mentioned the violation of the separation of powers in the continued state of emergency and said, quote, government cannot protect us from every single one of life's risks, and later said 99% of us we now know will be safe from this virus. Yesterday, your office said you would not support Grendell's legislation. Considering your answer on Tuesday, the federal decision from Judge Stickman in Pennsylvania, and given the latest science showing that exposure to the common cold provides COVID T-cell immunity in 40% to 60% of the population, meaning a vaccine may not even be needed for most people, why not follow the science and support the legislation to end the state of emergency? And then how are we doing with the antibody test results? Thank you.
Well, I wish it was as simple as passing a law to get us away from the emergency that we're in. I mean, factually, we are in an emergency, whether it's declared or not. We've declared it as an emergency, but passing a law saying it's not an emergency is not going to make it not an emergency. And I say that with all due respect to her. She and I were talking the other day on a bill signing that she had sponsored. So I have a great deal of respect for her. But look, passing a bill just doesn't make it not an emergency. We have an emergency. We have significant spread. We have people dying. And we can do this. And, we can do two things at once. We can keep our economy going. We can go to our kids' sporting events. We can do a lot of different things. But we still have to do some careful things, and wearing a mask and keeping the social distance are very, very necessary. So, no, I certainly do not support that. We have an emergency, and when we're done with the emergency, we'll be done with the emergency. And I can't wait.
Next question is from Jackie Borchert at the Cincinnati Enquirer.
Good afternoon, Governor. As you mentioned earlier, there is a game tonight, and many Cincinnati Bengals fans might be heading across the river to Kentucky to watch the game since Governor Beshear pushed back its liquor curfew to 11 p.m., an extra hour compared to Ohio. Ohio bar owners want to know, will you follow suit and push back the curfew here?
I don't know yet. I mean, look, we're going to consult people in different communities across the state of Ohio. As you know, as I've reported before, Mayor Cranley would like to see us do that. But we have other mayors in major cities in the state who do not want us to do that, feel that this has been very helpful in slowing the spread down. Cincinnati is in a unique position because people can go across, certainly can go across the river. Let me use this occasion also to say, since we're talking about football, and I plan on watching the game tonight, should be a lot of fun. But our concern really is as the NFL starts back up, and now we'll have Ohio State in the not too distant future. A lot of us are going to be watching TV, watching these games. A lot of us like to do it with friends, and that's great. A lot of us like to go into bars and watch it, and that's fine too. But we just ask people, you know, when we talk about football, the big question was, is it safe? You know, I have a concern, frankly, about what results if a lot of people are getting together in bars, and we saw some pictures the other day, you know, the first weekend of football, NFL, and, you know, people were not distancing. And so those are just by their nature dangerous. And so we can enjoy the NFL, the Bengals and the Browns, and we can enjoy Ohio State, and we can enjoy UC and other teams that are playing, but we can do it. We ought to try to do it in a safe way. And that would be my request, if people could do that.
Next question is from Justin Dennis at mahoningmatters.com.
Good afternoon, Governor. I'd like to get back to nursing homes for a moment. We heard from a group of Ohioans who are pushing for some way to offer additional care or FaceTime with their loved ones in nursing homes, possibly by designating them as essential caregivers. Other states have enacted legislation to that effect, which would allow those relatives inside nursing homes and to visit with their loved ones for longer. Is there anything that you can share about the state's upcoming guidelines that might align with that? And when can we expect to learn more about that plan?
Yeah, again, I want to emphasize, though, the nursing homes for months have been permitted, and we've given them guidance about allowing visitation. And I know it's very frustrating that there are nursing homes that are not letting people visit, or they're letting them visit for 15 minutes. I mean, unless they're really, really busy, it seems to me more than 15 minutes should be allowed. We want them to do it safely. We don't want the virus coming in, but they're doing it outside now. They're doing it with people who have face masks. So I just would say that unless the nursing home has COVID in there or some real reason not to have that, the nursing home should be allowing people to visit. They need to be careful. We're now coming up with protocol, which Director McElroy will be announcing shortly, about how that will happen as it gets colder, and, you know, visitation outside is obviously going to be difficult or impossible, and how we'll be able to, we hope, carefully move that in. In the long run, the more testing we can get into nursing homes, the more we're going to be able to have visitation, and the more we're going to have life that will be more normal for the people the residents of the nursing homes. And so we're working on that very, very hard, working on that this morning, and we'll continue to work on that. So, you know, we're seeing more and more testing coming out. We're seeing the cost go down, you know, and the more testing that we can do inside nursing homes, the safer it's going to be. But we still, as you know, are losing a lot of people in nursing homes. And it's just, you know, breaks my heart. And so we still have to be careful. We can't just say we're not going to be careful. So when people go into a nursing home to visit, when we get to the point where they're physically going inside, you know, again, it's going to even be more careful, more important that they not have temperature, that they not be positive. I mean, at some point, we're going to be able to get to the place where we, in addition to the normal screenings that we have in effect, wearing masks and those other things, that a test will be available at a reasonable cost, and that person will take that test, wait 15 minutes, and if they pass that test, they would be able to go into that nursing home. Now, it's not 100% not perfect, but that would be one more screening device added to the devices, the things, the mask, and the other things that we already have. So that's kind of where we're going in the future.
Next question is from Marty Schladen at the Ohio Capitol Journal.
Good afternoon, Governor.
Marty.
Do you agree with former governors Taft and Celeste that Ohio should prepay postage on absentee ballots? And if you do agree, what do you make of the controlling board's decision not to do so?
Yeah, I think I said last time, or at least I thought about, maybe I didn't say it, that I'm in favor of that. But I also say that we still have a good system in Ohio without paying for that. We do have a situation where, you know, everyone got the application that was mailed to them. So, you know, Ohio is aggressive. Secretary of State is aggressive. I think, you know, we're doing a good job in Ohio in letting people vote and trying to make it as broad as we can and giving them every opportunity. But no, I'm on the other side of that, but it was clear to me some time ago that there simply was not an appetite in the General Assembly to do that. And in fact, that there were members of the General Assembly who did not favor doing that.
Next question is from John Reed at Gongward News Service.
Good afternoon, Governor.
Hey, John.
Treasurer Sprague suggested today spending $100 million from the Coronavirus Relief Fund on grants for small businesses to help them through that. Is that something you would support? And do you have any other ideas of how the rest of that money might be used?
Yes, I do. We're working on that. I intend to work further on it this weekend. I'm glad to get his recommendation. I know that, he was putting that out, and we've received recommendations from other people, talking with members of the legislature about this. We should have recommendations to come out next week. So we'll stay tuned. We'll have more.
Governor, next question is the last question for today, and it belongs to Jim Oddie of WHIO in Dayton.
Governor, let's return to football. To what degree are you satisfied with the protocols to keep players, coaches, and staff on the field safe? And if you feel safe about that, would you support returning fans to the stands, let's say, for example, 6,000 fans at Ohio Stadium, as will be at the game tonight?
Jim, you're talking about, we got high school, we got college, we got NFL. We're talking about all three? What?
Specific to college, the Big Ten returning.
Yeah.
Are the protocols in place?
Yeah. Look, I think the protocols are in place at Ohio State. I can only talk about Ohio State, but I'm convinced the protocols are in place. Dr. Borchers, who's advising the Big Ten, is from Ohio State. I've talked to him on numerous occasions about, how things are going at Ohio State and testing the athletes, not just the athletes for football, but all the athletes. I think they have a very, very good protocol. Look, as far as putting people in the stands, that first is a decision of the Big Ten, then a decision of Ohio State. There is no reason that we could not do something similar at Ohio State to what we're doing with the Bengals and the Browns. They both came forward with very good plans. We basically divided the stadium up in 4 areas, 1,500 people per area, which is what our maximum is for high school. And so I'm convinced that will work out very well. I think it's going to work out very well tonight. We'll turn on TV and watch. But I think it's going to work out well with the Browns and the Bengals. Again, the real concern is not what happens inside that stadium with 6,000 people. The concern is getting in, getting out, and what the congregating together. I mean, that's just what you worry about purely from a health point of view, is people congregating together in close proximity to each other. I think what you're going to see tonight with the Browns, they're going to have people spread out. People are going to be wearing masks. People are going to be safe. They're going to be safe inside the stadium. And so certainly we could expand that if Ohio State wanted to. We could expand something similar to that to Ohio State. Cleveland has done the right thing, and the city has done the right thing. Doing everything they could to discourage tailgating, everything they could to discourage the congregation. We all love tailgating. I love tailgating. But this is a time when we're kind of shifting things off. We're making a sacrifice here so we can do something else, and being able to have the game, be able to attend the game for some people, and for the rest of us to watch it on TV and the players to be able to play. Those are all good things. But the congregating together is just something that's not healthy. Jim, thank you very much. We look forward to seeing everyone on Tuesday. We hope you have a good weekend. Thank you very much.